Welcome back, everyone, to another fabulous episode of Health Care Trailblazers. I am honored and excited to be sitting here today with Dr. Gordon Chen of ChenMed. ChenMed is a fascinating and quickly growing organization. Dr. Gordon Chen, together with his brother Dr. Chris Chen, built this organization, and they're doing something really interesting, really innovative in healthcare. We're going to talk about a lot of different things today. They also just released a book called The Calling, the ChenMed story. It's a family-run business, like I said, doing a lot of interesting things. So, Dr. Chen, thanks so much for sitting with us today.
Mendel, it's wonderful to be here with you today. Thank you for having me.
Absolutely. So, we like to do this with our guests. Let's zoom out a second, take a step back. You and your brother are growing up. Take us to the beginning of your story. How'd you get involved in healthcare, and what was the seedling that is now ChenMed?
Well, we always, both Chris and I always wanted to be physicians. And, I think it's out of great admiration for my father. My father came from Taiwan, came over, got his PhD, and then went to medical school. He actually did medical school in 2 years in an accelerated program, and then started practicing medicine. And so just through that admiration, like watching him, but then also whether or not it's going with him on home visits back in the day when we were young kids, or going with him on medical mission trips, and just seeing the impact that he could have in patients' lives, it was very inspiring. I remember just having him interact with a patient, put his hands on a patient to examine them, their whole countenance changed. It's almost like that interaction, that touch just already started healing the patients. And so for me, that inspired me to say, hey, I want to be a physician. I want to live a life where I'm positively, bringing health to my patients and my communities. So that's how it got started. Chris and I, both went to medical school here in Miami, and we also, obviously followed in his footsteps as well. He's a University of Miami graduate, and then we all had this vision that one day we would work together.
Wow. What's the age difference between you and Chris?
We're 3 years apart. Yeah, he's my older brother by 3 years.
He's your older brother? And how many siblings are you?
Just he and I. So
Oh,
we're
cool.
a very, very tight family, as you can imagine.
Yeah.
My parents came from Taiwan, and then just having the two of us, and then no other family down in South Florida. So you can imagine, when I was in medical school, and my dad got sick, and we thought that we were going to lose him. We thought, he was given 2 months to live after discovering a golf ball-sized mass behind his nose.
Oh,
And so my brother was in his fellowship, and I was finishing medical school, and getting that news, just shocking, right? To go from a family of 4 to potentially a family of 3, and losing the patriarch, your dad, that was a very difficult time with a lot of, suffering and a lot of time just trying to, figure out who we are and what we're trying to do.
Did that experience help you see maybe some of the dysfunction that's prevalent in the healthcare system? Was that like okay?
Absolutely. So we had always approached healthcare like we are the ones healing, right? We're going to be the physicians, or we're the physicians, or we're providing the care, and we have the know-how, the resources, the expertise, and then instantly that changed to we're the patients, and we're the ones that were completely vulnerable, fighting to get into a doctor's office, getting pushed out weeks and weeks. And when you only have 2 months to live, and your appointment, you can't make an appointment with the right doctor, it's very frustrating. And so we felt like we needed to, take the bull by the horns and try to force our way to save my dad's life, to get him into the right appointments, to try to coordinate the care, to try to figure out between all the different specialties and the primary care, and on top of that, the complications. We had ER visits for blood clots, for neutropenic fever, for seizures, even a stroke. And so we had all of these complications, and we're trying to navigate through this this complexity, wondering how in the world are patients or like, let's say, seniors across America who don't have our resources or education or connections in the field, how are they making it? And the reality is many of them aren't. Many of them are falling through the cracks. Many of them are suffering just like we suffered, but maybe not making it through.
Yeah.
Dying unnecessarily, dying early. And this is what we see across America, right? We see this huge gap between the people that have resources and know-how and the people that don't. And then the gap is widening. So the communities that are underserved and these healthcare disparities continue to widen, which is why this focus on health equity couldn't be more important. And so we experienced that, and then we were like, well, first of all, thank God my dad's cancer-free and alive today. Thank God.
Thank God.
But we really feel as a family, after suffering through that, and it was the passion and this fire in the belly that said, we need to fix it. We need to do something about this. And so, how do we start with one medical center? How do we go from 1 to 2, 2 to 4, and then get our model, which we know works. It's a proven model. It's replicable. We deliver better outcomes, better service. But how do we get this across the country to seniors and communities in most need?
So, when your dad got sick, that was obviously before you started ChenMed, right?
So my dad had one medical center and 4 other physicians working for him.
Oh, okay. So he had his own practice at that
he had his own practice, and he had a methodology. It was full risk. My mom was running the practice, and so when my dad got sick, he stopped seeing patients, and we're all fighting for his life. But then, as a family, we all came together not just to help my father through the cancer and the complications and all the different treatments, chemotherapy, radiation, but then also trying to figure out how to sustain the business.
Right.
And so
let's dig into the ChenMed methodology for a second. So you've got these different transformative experiences for yourselves early on in life. You've got the background. We see how a lot of these kind of ingredients for the success of ChenMed start coming together. Close with your brother, close with your family. What was that methodology that you said, all right, we're going to do something, we're going to do it at a really big scale, and we're going to do something different? What was that difference that you started off with that you're continuing to do today?
So what we realized, at the heart of helping patients get better outcomes, you need a physician that can take accountability for patients' health and their lives. And when I say accountability, I don't mean accountability for transferring knowledge to the patients. I mean accountability for their health outcomes. And so there's a pivot there to say, hey, as a doctor, I'm an expert. I'm accountable for just giving the information to, as a doctor, I'm accountable for what happens to my patients, how many times they get hospitalized, whether or not they have a heart attack or stroke, whether or not they take my recommendations. I am accountable for that. And you start to change your approach as a physician or as a PCP to say, I need to change what I'm doing so that the patients change what they're doing. So if the patients don't change, you don't get to better health. And so very quickly, you take a physician and you transition that physician into an outcomes-based champion, which requires them to be an expert in influence. Very different than an expert in medicine. And so you have that expertise in medicine plus the expertise in influence, and you add accountability, and all of a sudden, patients start doing better. They don't get hospitalized as much. They live longer, and then they have a tighter, deeper relationship with their physician. And so that's a beautiful situation where everyone wins. But what you have to do is you have to start to think about healthcare differently. You can't
Yeah.
have a doctor take full accountability for 3,000 patients because that's too many relationships to manage. And so we've studied this and we figured out it's somewhere between 400 to 450 patients where a doctor can take full accountability for those patients and develop deeper, meaningful relationships with those patients and see them proactively rather than reactively. So
I'd like to highlight something that you're saying because I want people to really appreciate, I think, just a really interesting point here. What you want is doctors to take that accountability, but what you broke it down to, which I think is genius, is in order for a doctor to really take accountability, they have to know that they have buy-in from the patient, because the doctor can do everything that they want from today till tomorrow, and at the end of the day, if they don't have that buy-in from the patient's not taking the recommended actions or the preventive actions or whatever it is, then they're not necessarily going to get the outcomes that they're supposedly taking accountability for. So what you're saying is you took that step back and you said, all right, instead of focusing even on the outcomes, the influence, that's what I think is really interesting there. How does that doctor, just to go back to that point that you said, figuring out how the doctor can influence the patient, the outcome will happen by itself if you can make that happen. So I think you're even a step further. Instead of people just focusing on the outcome, which in itself is a change, right, in today's healthcare climate, you're saying we're going beyond the outcome. We're saying let's focus on that, on the influence. If a doctor can influence and really connect with their patient, they'll get the buy-in from the patient, and the outcome will happen by itself. Am I getting that right?
Absolutely. And Mendel, this is where it gets really exciting for doctors, right? Because if you think about influence is leadership. Nothing more, nothing less. We hear this from John Maxwell, we hear this all over the place. But what you're really doing is you're teaching doctors and giving them an environment where they're leading. And once doctors really master influence with their patients and they lean into the accountability for outcomes, then not only can they lead their patients, they can lead other doctors, they can also lead both the clinical aspects and they can lead the business aspects of medicine. And so you're broadening the doctor's reach, right? Just by investing in their leadership development. And so at ChenMed, what we do is we're laser focused, understanding that influence is leadership, and we can't get to better outcomes without that influence and that leadership. We invest probably 50 times more than any other company into physician leadership development and growth. And so when you think about like our physician experience, they come here and they have preceptors, mentors, they have executive coaches, they have a year-long black belt training program while they practice to help to refine and improve their influence skills. They have an opportunity to really lead the business as well. And so if I were to simplify one of the things that ChenMed is really laser focused on, it's being the best clinician leadership development organization in the world. And I think that's been the differentiator for us, because physicians, they love to broaden their influence. They just don't know how, and most organizations aren't investing in them. So
most organizations themselves don't know how.
Yeah.
So, and as an objective bystander, someone that follows ChenMed and your various physicians on LinkedIn, I could say that you see that pretty clearly. I mean, a lot of your physicians have their own persona and are driving their own points on social media, and I would say that you do see, just forget like, aside from the focus on influencing the patient, what you're saying about developing and influencing at large, I think you see that pretty clearly with a lot of the ChenMed physicians, which I think is fascinating. So you're obviously doing a good job at that. That's great.
Thank you. Yeah,
Yeah. So let's talk about kind of the difference between you mentioned earlier shortly some of the difference between value-based care, which in itself is a gigantic shift for some people, and it seems that you've got kind of a little bit further down the road where you're looking at something that you like to call transformative care. So why don't you unpack that a little bit and talk about what that means?
absolutely. So you have the majority of healthcare today in what's called fee-for-service or transactional care. Now, there is a role for fee-for-service. There is a beautiful role, but it can't all be fee-for-service. Then you get what we have today, which is just too many incentives focused on volume and transactions, and you don't get better health. You actually, oftentimes can promote sick care. And so it's very clear that we need something more than just that transactional care model. And so what everyone is focused on is value-based care. The problem with the move from transactional care to value-based care is that the way of thinking is different. The complexity, if you do both, increases dramatically. And so there are a lot of health systems that they try to do value-based care. They spin their wheels because 90% of what they're still doing is back in transactional. They're trying to migrate over to value, and then they're not actually getting the behavior change in their doctors or in their patients that they need to produce better outcomes. So what we say here at ChenMed is, hey, value is a great first step away from transactional care, but it's not the destination. What we really want to be pushing is an outcomes-based care focus, which is a complete dedication to the outcomes of the patient, which requires the transition to this mindset of behavior change, right? As a health system, as the doctor interactions. And so the outcomes-based care says, hey, there isn't any confusion between whether or not you're paid for transactions or you're paid for outcomes. You're paid for outcomes. Now, you couldn't do that in a full risk model because you're rewarded when you have better outcomes for your patients. Lower hospitalization rates, better outcomes, patient wins, you win as well. Now, pushing that even further, because even if we had a few outcomes-based care models across the country, that's not enough to transform American healthcare, right? Like, that's not enough. So what we need is we need a scalable approach to outcomes-based care. So we say, all right, there's transactional care, value-based care, there's outcomes-based care, which is focus on outcomes, right, without compromise. And then there's how do you scale that outcomes-based approach, which is what we call transformative care. And to scale that, you need, number one, you need a very good why and mission focus, right? And so I think this is the reason why ChenMed's attracted so many mission-driven people. Like, probably the reason why we got selected for the Fortune magazine Change the World list. Probably the reason why we were the #1 company in healthcare by Newsweek, right, for most loved companies, because people love to work with mission and purpose. So that's the first thing you need for transformative care. The second thing you need is you need the right data, the right technology, the right systems, right, that allow you to scale the outcomes-based model. And then the third thing you need is you need outstanding focus on physician leadership development. And so that's what we call here at ChenMed transformative leadership for transformative care. And so we're just laser focused on these three critical areas to allow us to push the country, to lead the country, to transform the country towards more of this transformative care model.
That's amazing. I want to give a short example, even though I would like to leave this for a whole episode for itself. But I did have the good fortune of chatting with one of your doctors, Dr. Faisal, right?
Yeah, Dr. Faisal Syed, yeah.
Faisal. It looks like kind of a Jewish name, Faisal, and anyways, and he gave me a very, see what you're talking about, the general concept. I want to give people a really plugged in, super down to earth embodiment of this idea. He said how he does not allow, and he instituted through with ChenMed that you guys do not allow your front desk people to call a patient a walk-in. They call the patients a patient in need of medical care, and the difference in language, and it actually makes total sense. The difference in language said, when someone comes in and they weren't scheduled and they say, oh, I've got a walk-in, no one wants to go see that patient because it's a walk-in, But when someone comes to the back and says, hey, docs, I've got a patient in need of medical care, that's what they signed up for, to be doctors about. So all of a sudden, you've got this transformation where doctors are saying, yep, I'd love to go get that patient. And I think, that focus, it clearly trickles down from your, just to show people that it's working all the way on the ground level, affecting your nurses and your MAs and your front desk staff. You're obviously, it's easy to talk about abstract concepts at the top, but to see it actually plugged in and working on the ground level, I think is really great. And to talk about scale, how many doctors and practices do you have at this point, locations?
So we're at 120 locations, over 500, clinicians and clinical leaders. And, to your point on that whole patient in need and the mindset shift, it's the underlying question: are patients here for us, or are we here for our patients, right? And if they're coming to us with a need, we want to be there for them. And so often, because of whether or not it's the training or the expertise or the years that doctors put in, oftentimes, we have the approach where patients can wait as long as they wait to see me, the doctor, and we try to flip that upside down and say, hey, we're here to serve the patient. If we make it too uncomfortable for patients to come to us when they have a need, or maybe it's not an urgent need, maybe it's just a standard like preventative visit, which is still very important. But if we make it too painful for them, they're not going to come. They're gonna wait at home until whatever their chronic conditions become acute conditions, and then they're going to go to the ER, right? And so we need to create an environment where the shift of our mindset is focused on them and their need, and that really it's back to kind of this concept of servant leadership. We're here to serve them. They're not doing us a favor. We're by coming to see us, like we are here to serve them and meet their needs.
Amazing. Gordon, I'm just observing how animated you are and how clearly inspired you are. 120 centers and hundreds of employees in. You're literally, you probably don't realize, but you're literally jumping to the edge of your seat when you start talking about some of these concepts. You're clearly very driven and continuously inspired. And I think that in healthcare, it's very easy to become uninspired because, when you're so deep into it, especially when you're up at the top. So you could get disconnected. You're clearly plugged in. You're clearly continuously inspired. What's driving you? What's that continued inspiration to see ChenMed to go from where you are now to 500 centers and beyond?
Mendel, that's a great question. When we as a family were suffering through my dad's cancer scare, it became very clear that every day is precious, right? When you're given 2 months, for your dad to live, you're like, every day is precious. And if I were to just be kind of open and transparent, I don't want to push my beliefs on anyone, but just being open, I believe that every day is a precious gift from God. And through that experience, and then also my brother almost dying from COVID, right? Our CEO, he almost died from COVID. He was in the ICU for 4 to 5 days. And just every day he was in there, we were like, is he going to get intubated? Is my brother going to make it? I don't know. And, and this was in 2020, right? When we really didn't have much. And so that was just another painful but very revealing reminder that, again, every day is a precious gift from God. And so for us as a family, purpose is critical. And so we aligned around our family purpose, which is to glorify God by spreading more love and promoting better health in all who come to contact with ChenMed. And just to say that in simple terms, it's like, hey, every day, if I can spread more love and promote better health in a way that honors my Creator, then that's a good day, right? Absolutely. And so, when you have that purpose in combination with recognizing that we have a model that can decrease hospitalizations 30 to 50%. We have an ethical responsibility to help bring that care model to as many needy communities and needy patients as possible. And so I get excited about that because we're living out our mission. We're going after our family's calling. And so, like, who doesn't get excited about trying to rescue, seniors in a broken healthcare system?
Right.
Who doesn't get excited about the potential to literally transform American healthcare? I mean, if you think about American healthcare is like 20% of the U.S. GDP.
Yep.
It's probably the largest business in the world, right, at 20% of the U.S. GDP. And everyone agrees that we're getting horrendous value for what we're spending, and it's broken, and there's a divide between the wealthiest and the poorest. And so we need to fight for the underserved.
Amazing. Dr. Gordon Chen, thank you so much for sitting with us today. We can go on and on all day, but you've got a mission to get back to. And everybody, if you want to hear the full story, definitely go check out The Calling, new book by Dr. Gordon and Chris Chen on the entire story of ChenMed and where they're going with it. Highly recommend, give it a read. Dr. Chen, thanks so much for coming by today.
Thanks so much, Mendo. And if I could just say, I mean, as we grow and expand and plant more centers, we're opening 20 to 40 centers every year. We're looking for great PCPs, clinicians, physicians, healthcare leaders that share the same passion for transforming American healthcare. So they can find more information, visiting our website, www.chenmed.com/physicians. So chenmed.com/physicians.
Click here and there and down there. There'll be links all over.
Thank you.
Amazing.
Appreciate
Absolutely.
it, Mendo.